We're here at the 75th FIP World Congress of Pharmacy and Pharmaceutical Sciences, which is a great opportunity to discuss global health. We have the opportunity to have a few words with Kwok Cho Tang, who's the coordinator of health promotion from the World Health Organization. So as we start, I'd like to share the definition, the WHO's definition of health promotion. It is the process of enabling people to increase control over and to improve their health. It moves beyond a focus on individual behavior towards a wide range of social and environmental interventions. From your perspective, how do you operationalize health promotion?
Yeah, first of all, thanks for the invitation. Actually, the definition actually came from the Ottawa Charter. Yeah, when it was held at the conference, was held in 1986. Mm-hmm. And to operationalize and put actually the term into practice, mm-hmm. the how dimension can best be characterized by the 5 action areas set out in the Ottawa Charter. Okay. And they are developing healthy public policies, creating supportive environment, strengthen community action, developing personal skills, and reorienting health systems. I give you maybe 3 examples to illustrate.
Okay.
Medication compliance, mm-hmm. yeah, is actually personal skills. Mm-hmm. Yeah, no smoking and consumption of less salty, sugary, and fatty products, mm-hmm. or foodstuff. Mm-hmm. Easy access to affordable quality medicines. These are all actually the what dimension examples of health promotion. Yeah.
From the WHO perspective, what's the role of pharmacists in health promotion?
Okay, so maybe I also actually make it more explicit actually about the what dimension, mm-hmm. in terms of operationalized health promotion. We need to look at disease, risk factors, as well as determinants of health. Yeah, those 3 examples I gave a bit earlier on just illustrate the 3 actual aspects of the what we would like to achieve. Talking about the roles of pharmacists, I think it sets out very clearly in the GPP. Yeah, and I just I was a bit curious actually when I actually prepared my presentation this afternoon. I look at actually, pharmacists who are famous, mm-hmm. and look at what they actually did in the past or are still doing, and then try to see what their role should be. And I found actually really interesting actually get into politics, making pharmacists famous. Mm-hmm. Yeah, I think of course, to get into politics with a good cause, right. Making healthy public policies. I also actually learned a lot actually by looking at, what these famous pharmacists did. For example, they invent actually many things, drugs, penicillin, mm-hmm. the disposal syringe, yeah. And also maybe something like child-proof medicine containers. Right. So that may also be actually roles of pharmacists. Right. And more importantly, I think what I would like to say actually, pharmacists, they need to ensure, the health of the people, of people of a disadvantaged position. I think this is actually very critical, mm-hmm. for health promotion.
So you mentioned a lot of opportunities for pharmacists, promoting adherence, promoting access to medications, smoking cessation, getting involved in politics. Can you think of anywhere in the world a specific example today where there's somebody who's living these examples and doing exactly the work that you're thinking of?
Yeah, certainly. Actually, but I mix up actually, the day. Actually, I need to look because the way I look at these pharmacists, actually their day of birth, mm-hmm. and some I couldn't actually get their age. Yeah, so that's why this part I need to qualify. Yeah, based on our research, actually, for example, a pharmacist become minister. and decided to come up with actually some healthy public policies. Yeah, it's actually quite not uncommon. Yeah, and actually there are also actually there were or also are pharmacists. Yeah,
It sounds like a call for pharmacists to get involved in politics.
And you know, as I mentioned, I think to get into politics actually for a good cause. I think what we would like to see is actually, you know, we want to, maybe we ask actually the pharmacists to consider whether they should be access and quality champions, which means to vigorously support and defend easy access to affordable and quality medicine. I think this is important. And actually back to your question a bit earlier on about interesting thing actually pharmacists are doing. I actually read actually a pharmacist from India and Kenya. They are working out some innovative ways to supply and distribute generic drugs. Yeah, because I talked the other day, I talked to actually a GP who went to India on vacation, and she was thinking how actually, you know, people in remote areas have access to simple drugs. So these are actually something maybe actually, you know, away from our radar screen as an urbanized person, but it happens actually, you know, day to day in many parts of the world. Yeah.
So you talk about the charter or the charge of health promotion coming from the Ottawa statement. And the 8th Global Conference on Health Promotion took place in Helsinki in 2013. And as a result of that meeting, it seemed there was the Helsinki Statement on Health Promotion, which included a framework for how countries can implement those. What's been the impact of that work?
Promoting action across sector and putting health in all policies has been around for a long time. Based on my own research, it happened even at the 7th century. At that time, quarantine is already was happening. Detaining actually 6 sailors back to the country. But you know, these two approaches, or this approach putting health in all policies, has been gathering momentum since, you know, the past few years. The Helsinki Statement and the framework is part of the process. And certainly at the moment, what we would like is to implement actually the statement and also the framework. One concrete example of the impact of actually the conference, of course those two are key documents of the conference. The conference led to a resolution, WHO Resolution 67.12, require WHO to develop a country framework for country action to support actually action across sector, to provide technical assistance to our member state, and also to work well with our UN partners. So the resolution was developed and endorsed at our May earlier this year, the Assembly. This is also a huge impact of the conference. As I mentioned a bit earlier on, what we need to do is to implement actually the statement and framework. For example, we want to set up demonstration projects to apply actually, you know, the framework. At the same time, based on country experience, to revisit the framework. We want to put together case studies, we provide training, and we also want to get actually, if you know the framework, the how to is so important. We need to ensure the universities, they will develop programs, courses in their academic program, so that public health practitioners can benefit from their undergraduate or postgraduate studies.
So I know that the Helsinki Statement and the framework are both available on the WHO website, the Project for Health Promotion. So if countries or schools or groups are getting involved in projects or implementing these statements, how does the WHO learn about that work?
So, WHO, we have 3 levels. Yeah. So we have colleagues in Geneva. We have also colleagues at the regional offices, at the regional level, and we have also country offices. And the country offices, they basically are our, most important piece of,
Like a liaison.
Yeah, not only liaison, eyes and ears, also, the frontline people, they can actually provide immediate support, mobilize resources to work with the country to address actually the country's encounters. Yeah.
And it seems like you have the 9th Global Conference planned for 2016 in Shanghai.
Yeah.
What are the priorities of that meeting?
Okay, yeah. And, the 9th Global Conference will be held in November next year. So it's still about 14 months away. Yeah. The title of the conference is Health Promotion in the Sustainable Development Goals. Yeah. So we would certainly like, through this conference, to see how best we can use health promotion to realize the Sustainable Development Goals, which has been actually endorsed only a few weeks ago. Yeah, last week, actually in late September. And apart from actually this important task, we would also like to see, I mentioned a bit earlier on, October was held in 1986, it's exactly 30 years. We want to see actually what has been achieved or what has been achieved over the past 30 years and what lessons we have learned. And more importantly, we want to see what needs to be done within the next 15 years, rather than building on the gain in the past and shape actually our action, our course forward.
Great. Are there any closing thoughts you'd like to share?
Yeah, I want to repeat actually what I said a bit earlier on. I think we need to ensure people, especially those in a disadvantaged position, they have easy access to affordable and quality medicines. We want, well, maybe, the pharmacists can say whether they should be or can be access and quality champions to vigorously support and defend actually this good cause.
Great. Well, thank you very much for your time.
Thank you.
All this and more at FIP Congress.